Hello friends, I'm Dr. Jeevatram. Today I will discuss about the meningitis and its treatment. Meningitis is an inflammation of the membranes meninges surrounding your brain and spinal cord. The swelling from meningitis typically triggers symptoms such as headache, fever, and a stiff neck. Symptoms. Early meningitis symptoms may mimic the flu, influenza. Symptoms may develop over several hours or over a few days. Possible signs and symptoms in anyone older than the age of 2 include sudden high fever, stiff neck, severe headache that seems different than normal, headache with nausea or vomiting, confusion or difficulty concentrating, seizures, sleepiness or difficulty walking, sensitivity to light, no appetite or thirst, skin rash sometimes such as in meningococcal meningitis. Signs in newborns. Newborns and infants may show these signs: high fever, constant crying, excessive sleepiness or irritability, inactivity or sluggishness, poor feeding, a bulge in the soft spot on the top of baby's head, stiffness in a baby's body and neck. When to see a doctor? Seek immediate medical care if you or someone in your family has meningitis. Symptoms such as fever, severe unrelenting headache, confusion, vomiting, stiff neck. Causes. Viral infections are the most common cause of meningitis, followed by bacterial infections and rarely fungal infections. Because bacterial infections can be life-threatening, identifying the cause is essential. Risk factors. Risk factors for meningitis include skipping vaccinations, age, living in a community setting, pregnancy, compromised immune system. Complications. Meningitis complications can be severe. The longer you or your child has the disease without treatment, the greater the risk of seizures and permanent neurological damage, including hearing loss, memory difficulty, learning disabilities, brain damage, gait problems, seizures, kidney failure, shock, and death. Prevention. Common bacteria or viruses that can cause meningitis can spread through coughing, sneezing, kissing, or hearing, eating utensils, a toothbrush, or a cigarette. These steps can help prevent meningitis. Wash your hands. Practice good hygiene. Stay healthy. Cover your mouth. If you are pregnant, take care with food. Immunization. Some forms of bacterial infections are preventable with the following vaccinations: Haemophilus influenza type B vaccine, pneumococcal conjugated vaccine, pneumococcal polysaccharide vaccine, meningococcal conjugated vaccine. Pharmacological treatment. When the causative agent is not known, adults, injection chloramphenicol 1 gram every 6 hours IV initially, and after a good clinical response, continue with all treatment at the same dose for 14 days. Plus injection benzyl penicillin 5 million units IV every 6 hours initially, and after good clinical response, give same dose IM for 10 days. Children and infants less than 3 months, injection ampicillin 50 mg per kg per dose IV 6 hourly for 10 to 14 days. Plus injection gentamicin 7.5 mg per kg once daily for 10 to 14 days. Or injection cefotaxime 50 mg per kg per dose IV 6 hourly for 10 to 14 days. Children 3 months to less than 18 years, injection chloramphenicol 25 mg per kg per dose IV 6 hourly, plus injection ampicillin 50 mg per kg per dose 6 hourly. Or injection benzyl penicillin 1 lakh international units 60 mg per kg per dose 6 hourly for 10 to 14 days. Alternative treatment. Third generation cephalosporins, injection ceftriaxone 100 mg per kg per day in 1 or 2 divided doses for 10 to 14 days. For old age, immunosuppression, diabetic or alcoholic patients, give injection cefotaxime 2 gram IV 6 hourly, or injection ceftriaxone 2 gram IV 12 hourly, plus injection ampicillin 2 gram IV 4 hourly. Or injection cotrimoxazole 50 mg per kg IV daily in 2 divided doses. When the patient has convulsions, injection diazepam 0.25 to 0.5 mg per kg body weight by solo IV until control is achieved. In neonates, injection phenobarbital loading dose of 15 mg per kg. If convulsion persists, repeat injection phenobarbital 15 mg per kg after half an hour. Thereafter 10 mg per kg up to a maximum of 40 mg per kg. When the organism is known, meningococcal meningitis and pneumococcal meningitis. Adults and children greater than 2 years. Injection IV chloramphenicol IM 100 mg per kg is a single dose, maximum 3 gram. Or injection ceftriaxone IM 100 mg per kg is a single dose divided into 2 injections if needed and inject half dose in each bottle. Haemophilus influenza meningitis. In adult, injection ampicillin 3 gram IV every 6 hours initially, then change to all dose medication as soon as possible. Or injection chloramphenicol 50 to 100 mg per kg per day for 10 days. In children, injection ampicillin 50 to 100 mg per kg per day for 10 days or injection chloramphenicol 50 mg per kg body weight every 6 hours for 10 days. Injection dexamethasone started together with the first dose of the appropriate antibiotic has been found to lead to major reduction in hearing loss and death in both children and adults. Give IV 4 to 10 mg 6 hourly for 5 to 7 days. Neonates require treatment for 3 weeks and the recommended treatment is injection chloramphenicol 6 mg per kg body weight every 6 hours, but should not be used in premature low birth weight infants. Refer all patients not responding to treatment within the first 48 hours to a regional hospital.